possible that you can reverse your diabetes. We are talking about people with type 2 diabetes because it's not possible for people that have type 1 diabetes to reverse it. However, for people that have type 2 diabetes, there is the possibility that you can reverse the diabetes. It has come to my notice that there are a lot of misinformation and misguided utterances about reversing diabetes. And it's important for us as endocrinologists to come clear on the possibility of reversing diabetes and who can reverse diabetes. Is it every diabetic patient or is it every type 2 diabetic patient that has that ability to reverse diabetes? So you can see I have been talking about reversing diabetes, not cure, because there's a difference between cure and reversing diabetes. So what is the difference? When you say somebody has been cured from diabetes, it means that the individual no longer needs medication, he no longer needs to adhere to dietary advice, and his blood glucose is normal. So cure has not been achieved worldwide. All the clinical trials and attempts have not reached to that level that a diabetes patient is cured. It goes back to his previous life of taking refined sugar and other things and not having problem. This has not been attained yet, though there are efforts to do that. But when we say reversing diabetes, or we call a long-term remission, what we mean is that a diabetes patient having a very good control for at least 3 to 6 months without any medication, just on dietary advice and exercise. And it is a possibility. Uh, for me as an endocrinologist, I have almost 20 patients who were diagnosed early with type 2 diabetes that have attained that reversal. And a lot of them are continuing with adhering to dietary advice and exercise, though they have achieved that reversal of diabetes. So who are qualified to reverse diabetes? As I earlier said, it's not everybody. First of all, type 1 diabetes patient is not qualified. And for a type 2 diabetes patient, he must be in the early phase of type 2 diabetes, because type 2 diabetes is a spectrum from a stage of producing excess insulin to a state, but that insulin is not working. That's why the diabetes will come about, and to a stage that a type 2 diabetes patient is producing no insulin at all. So for you to be qualified to achieve that reversal of diabetes, you must still be producing insulin. Because if you have little insulin, it will be very hard for you to achieve that. Secondly, and importantly, that individual must agree that he's willing to follow dietary advice. You can't have that desire to achieve reversal of diabetes and you're erratic in following the instruction or following the guide given to you by the doctor and the dietitian. You cannot achieve that reversal of diabetes. So you must be disciplined and willing and also determined to follow dietary instruction. You must also be willing to follow the advice of exercise. Exercise is extremely important. Exercise, we usually say at least 5 times a week and also 30 minutes in a day. You can do a walk, jogging, cycling, swimming, dancing, whichever one is good for you. But my advice, as always, is before beginning any exercise, seek the advice of your doctor so that you be sure you're safe with the type of exercise you have chosen to do. Okay, so very importantly, so the treatments I've mentioned so far, you must be producing insulin, you must be disciplined, determined to follow the instruction on diet, you must be determined to exercise regularly. So if you are determined to follow this and you are still producing insulin, there is high chance that you can reverse diabetes. That chance may be up to 80 to 90%. My advice is whatsoever you hear online concerning reversing diabetes, be sure you understand that yes, it's possible, but understand the people that are fit to attain that reversal of diabetes. And if you fit into that, contact your doctor or your endocrinologist and discuss with him on that possibility.